Just as we wait for others to join, we do have a Menti meter. There we go. Yeah, as other participants join, we're just asking if you could go to menti.com and enter the code you see there on the screen, 53814397, or scan the QR code using your phone. That should work too. And that'll take you to a map, and you should be able to pin where you're calling in from. We're always interested to see where people are calling in from, and we'll just wait for others to join as we do that. And again, if you're just joining, please go to menti.com and enter the code you see on the top of the screen there, 53814397, and we'll just see where people are calling in from. So we've got some popping in now. Mainly America and Europe at the moment, it seems. Great. More and more coming in. And yeah, if you're just joining, please go to menti.com and there's the code at the top of the screen. You should be able to put a pin in the map just where you're calling in from. Great. So yeah, quite a spread of participants, and we see in the chat as well. There's quite a few different locations people are calling in from. So it's always nice to see where people are able to join, especially given the time differences and everything. Good. Okay, so there's a few minutes past. I think we can get going. And again, welcome everybody to this technical discussion on minimizing the environmental impact of humanitarian health supply chains. So yeah, I think we can move to the outline. So just an outline of what we'll run through today. We'll start off with an introduction of our panel members, and then just a very brief run through of the project that this technical discussion is a part of. And then we'll talk about the topic, which is sustainable supply chain management. Today, we're going to focus very much on waste management. We'll talk about sustainable supply chain management in the humanitarian sector. We'll then move into the main focus of the discussion today, which is the technical discussion. And then we'll wrap up with a closing. And yeah, just a reminder, please introduce yourselves using the chat function. If you have any questions, please use the Q&A function. And this just lets us track the questions better, make sure they all get answered. And there's also the ability to upvote a question. So if somebody else has asked a question and you'd like that answered, please upvote it and it'll go to the top of the list. Next slide, please. So by way of introductions, my name is Gurmeet Vellora. I'm a senior supply chain advisor with JSI. I'm focused at the moment on health system strengthening with JSI. We're very much looking at the intersection of climate change and supply chain. So I have about 15 years of experience in supply chain management, and the majority of that is in the humanitarian sector. So it's nice to see some familiar names popping up in the chat here. Next slide, please. And joining me as a facilitator today is Nora Quesada. Nora is JSI's Regional Director for LAC. She's an economist and holds an MBA. Nora has over 30 years of experience in international development, supporting a wide range of programs and projects in different countries. And most recently, she's been supporting projects that advance investments in women's health. And then we're also very pleased to welcome our guest speakers. So Samantha Blanchard is with the Joint Initiative for Sustainable Humanitarian Packaging Waste Management. Samantha is a graduate of UCL in London and also Dauphine University in Paris. And after working for 15 years in the humanitarian sector as a program manager in different countries, Samantha specialized in environmental issues and really the link between environmental action and humanitarian action about 8 years ago. Samantha's an independent consultant and has been supporting the joint initiative for about 15 months. We're also very pleased to be welcomed by Marco Matali. Marco is a pharmacy manager with the Italian NGO Emergency. Marco holds a master's in pharmaceutical chemistry and a PhD in chemistry. And Marco got his start in supply chain as a field pharmacist and is now leading the supply chain operations in the pharmacy department at Emergency. So we're very thrilled to be joined by Marco and Samantha. So today's session is being held as part of a BHA-funded capacity building program that JSI operates. And the objectives, broadly speaking, there are 4 objectives: to develop training materials, conduct capacity building activities, share learning with regional and global communities, and support organizations to really embed best practices in their operations. So as part of this program, we hold a number of technical discussions, and this is the first technical discussion of 2023. And if you want more information, there's the link there, and we'll be sharing the slides afterwards. Next slide, please. So the session objectives today, we want to review the definition of sustainability in supply chain management and look at the importance of sound practices for handling waste. We also want to share updates on recent global initiatives and trends that we've been seeing in the humanitarian sector, and really learn from each other, and especially our 2 experts here, on practices for being more sustainable in our waste management. But before we go into discussing the topic, we have another Menti. So please go to menti.com and use the code. It's the same code you might have used earlier, 53814397. And then select. We're just asking what percentage of plastic is currently being recycled worldwide. I see a few answers coming in. Great. Looks like the majority are going with 9%. Fantastic. Okay, good. And yeah, I mean, the majority is right, it is 9%, according to the UNEP, the UN Environment Programme. Only 9% of plastics worldwide are being recycled at the moment, which obviously leaves a huge gap, 91% not being recycled. And really just with this, we just wanted to sort of get the juices flowing, if you like, regarding the topic today. So next slide, please. So sustainable supply chain management. There has been an increased focus on sustainability in recent years. I think we've all seen it, really in the news, etc. And this is really driven by the climate crisis that we see around us, and also a focus on social equity and the need for strong compliance and governance systems in our operations. So if we take the UN definition of sustainability, which is up on the screen there, meeting the needs of the present without compromising the ability of future generations to meet their own needs. But we need to recognize that this is almost 40 years old now. And given the state of the world and the state of the crises that we're facing, there is an increased emphasis on being having more of a positive impact and being more regenerative. So approaches to sustainability are often built on the pillars of ESG, so environmental, social, and governance. We're going to focus today on the environment, but it's important to remember these are mutually reinforcing. So having a strong governance system allows you to really enforce strong environmental regulations with suppliers, etc. So they're kind of interoperable and mutually reinforcing. But today we're going to focus on the environmental aspects. So environmental consideration should be built into how we think about our programs in the humanitarian sector. And we can do this broadly under the categories of adaptation and mitigation. So adaptation is really recognizing that climate change is here, and we need to change how we operate in the face of the challenges we're seeing. So climate change is increasing the frequency and severity of the emergencies that we operate in. We see severe weather events becoming more frequent and more severe, such as hurricanes, floods, wildfires. And we also see change in disease burdens. Like malaria is moving into higher elevation zones. We see dengue moving into Europe where it hasn't been seen before, etc. So really, climate change is changing the operating environment that we work in. And it's often the most vulnerable that are the most adversely affected. So Annabella, can you go back? And at the same time, our supply chains are being impacted. So our operations, so these severe weather events can take our suppliers offline, can impact raw material availability, and can also impact transport infrastructure, knock imports offline, etc. So while the demand side is changing, the supply side is also changing. So there's therefore a need to adapt our operations in recognition of these impacts. And this happens especially, but not only, in the post-crisis and the preparedness phase that you see on that humanitarian program cycle on the screen there. But at the same time as this adaptation, we also need to recognize that our own actions contribute to climate change and environmental degradation. So depending on your operations, about 80% of an organization's greenhouse gas emissions can come from its supply chain. And that means that our activities can indirectly fuel some of the emergencies we are responding to. So we therefore need to mitigate and reduce these impacts and drive down the emissions that come from our supply chains. Next slide, please, Annabelle. Thank you. So this is the logistics cycle taken from the JSI Supply Chain Managers Handbook. And other organizations have similar ways of representing a supply chain, where really each phase has environmental considerations and trade-offs to consider for adaptation and mitigation. So we need to consider what we procure, how much of it we procure, where do we procure it from, and what are our suppliers' practices, and all the way through to where do we keep it, how do we move it, how do we transport it, and ultimately what happens at its end of life, its disposal. So really having a whole system, a total life cycle approach is key. And this is obviously a really big topic. It's as big as logistics and supply chain is big. So today we're going to narrow down and just focus on waste management from the products and the packaging that we procure. So what happens to the items once they leave our supply chains. Next slide, please. So health supply chains generate a large amount of waste, including packaging and hazardous and non-hazardous waste. And waste can mean that pollutants and harmful chemicals can seep into the environment and have a negative impact on human health and ecosystems. And so from seeping into the environment, we see, for example, microplastics entering our food cycles. And we also see air pollutants from open burning of waste entering the air and causing air pollution. But waste is also symptomatic of value seeping out of our supply chains. So the items that we procure and we bring into our supply chains have inherent value, and any waste that leaves our supply chains essentially is a lost opportunity, a lost value as it leaves. So over 75% of healthcare waste is general waste, and the balance is hazardous or radioactive. So really, over 75% of waste from our health supply chains can be dealt with as general waste. But this means segregation is important. If you mix hazardous and non-hazardous waste, all of that bundle then needs to be considered as hazardous and dealt with as such. So on the screen, we've put a simplified version of the waste management hierarchy. And this is essentially just an inverted pyramid with the most preferable method of waste management at the top and the least preferable at the bottom. And you can see the most preferable method is prevent the waste. Just don't have any waste, which is the most preferable, but obviously not the most feasible in most options. And then it runs through reduce, reuse, recycle, which a lot of people have heard of, all the way down to dispose of. So that's put something in landfill, burn it, etc. So that's the least preferable, as it leads to pollution and harmful chemicals entering our environment. And you'll see there that recycle is in the middle. So it's by no means the most preferable, because you need items that are designed to be recycled, and you need an infrastructure and systems in place to actually recycle. So there are quite a few trade-offs, as we've seen throughout the logistics cycle, really considering all the way down to waste management. And we want to get into these now with our two experts as we enter our technical discussion. So we're going to ask Samantha and Marco to join us. And I think our first question is actually for Samantha. And Samantha, really, we're just asking if you could give us an introduction to the joint initiative, just in case some of our participants haven't heard of it, and just talk about some of the environmental trends you're seeing in the humanitarian sector.
Yes, thank you. Thank you very much for the invitation. Yes, in a nutshell, the joint initiative is a BHA-funded initiative. It's a partner-driven initiative composed of various different types of stakeholders. We've got donor agencies, UN agencies, Red Cross and Red Crescent movement societies, NGOs, etc. And really the aim of this initiative is to reduce our environmental footprint, looking specifically at packaging waste. We have a holistic approach whereby we focus mostly on upstream efforts, so reducing the packaging waste that we use in our operation, and but also downstream, so improving waste management, trying to do as much reuse or repurposing of our packaging waste, but also recycling. We do that through information sharing and knowledge sharing. We don't necessarily have the solution by ourselves, so the idea is really to exchange best practices and learn from each other. Next, please. As to the humanitarian sector, I've been working in this field for 8 years now, and I've really seen a shift over the past 2 years as to how humanitarian organizations addressed this issue, and they're increasingly concerned about their environmental and climate footprint. You'll see on the picture here on the right is a distribution that was done in the Philippines a few years ago, of NFI items distributed in single-use plastic items, packaging, and which will end up in the environment as soon as they are distributed. So we're doing our best to avoid exactly that situation. And yes, donors have played a big part in pulsing this change in the humanitarian sector, especially ECHO and USAID. encouraging humanitarian organizations to really think and mitigate the impact. But it's also a collective, I think, responsibilities from all of us to be more accountable to disaster-affected population and to respect the do no harm. And I think that's a great news. Thanks.
Definitely is. Yeah, I think it's so encouraging, isn't it, to see all these changes. Yeah, and really sort of aligning with the humanitarian principles. And then Marco, in a similar vein, can you introduce emergency and also talk about, rather than at that global level, sort of what you've been seeing at the field, challenges in waste management?
Sure. Good morning, everyone, and thank you for the invitation. Emergency is an independent NGO. It was founded in Italy in 1994, and it provides free, high-quality medical and surgical treatments to victims of war, landmines, and poverty. But it also promotes a culture of peace, solidarity, and respect for human rights. Since 1994, Emergency has worked in 19 countries around the globe, providing free medical care in accordance with its core principles. Equality, so every human being has the right to be treated. Quality, so this treatment has to be of the highest possible quality available. And social responsibility, so this high quality treatment available to every human being should also be free according to emergency core principles. Emergency now works in many countries. He has been working in Afghanistan since 1999 with 3 surgical centers, one in Kabul, one in Annaba, and one in Lashkargah. There is also a maternity center in Annaba in the Panjshir Valley, and there is a network of over 40 first aid posts where the patients are stabilized and triaged before sent to the surgical centers. It's also running a rehabilitation center in Iraq, where there is also a vocational training center for victims of landmines and war. It's no longer working in Yemen. It stopped operation in April 2022, but it was there for a few years. It's very active in Sudan, where there is a big cardiac center in Khartoum, and then there are pediatric clinics in Mayo, which is a camp for internally displaced people near Khartoum, and pediatric centers also in Port Sudan, in the Red Sea state, and in Niala, in South Darfur state. There is also a cardiology clinic in one governmental hospital in Eritrea, a new pediatric surgical center in Entebbe, Uganda, that opened in April 2021. On the other hand, in Sierra Leone, Emergency has been working there since 2001, so for over 20 years, with a surgical center in Goderich, near the capital. And in Italy, Emergency has been running clinics for migrants in different cities. And as of last year, it started search and rescue operations in the Mediterranean Sea with its own boat. Of course, because the organization works in so many different countries, the challenges that we had in handling pharmacy and medical waste in the humanitarian projects have been quite diverse. In some countries, there are already laws that have educated the community on some best practices. For example, laws that are prohibiting the use of single-use plastic bags. The challenge in these countries was to allocate additional resources to the outpatient pharmacy, to the dispensary, to provide for paper or fabric bags that are more expensive than plastic bags. In other countries, the Ministry of Health or the Pharmacy Board, they might have already some guidelines in place for the management of medical waste. In many cases, they use third-party companies that are in charge for the medical waste. These companies can be expensive, or they can be not always reliable. Maybe the pickup truck breaks down, maybe the incinerators are not running because there is a lack of fuel, or maybe the waste is mishandled. In war zones or in areas affected by natural disasters, there could be disruptions to regular operations. For example, again, the incinerators could stop working because there is a fuel shortage, or the waste collection could be difficult because there is fighting on the road, or the infrastructures are damaged. In these cases, then it's very important to have contingency plans in place to secure medical waste in designated areas, so that is managed in a proper way. Thank you.
Thank you, Marco. Yeah, it's great to see the breadth of experience you have here. And then, yeah, I think switching back then to Samantha, and thinking back to our Menti question, could you talk about the recycling aspect that we've seen in the field?
Yes, thank you for the question. Maybe just to take a step back, I wanted to share a data of baseline assessment that we have done at the joint initiative. So as we all know, humanitarian agencies generate waste throughout their programs, but also at offices. In countries that don't necessarily have the capacity to absorb that additional waste. And so we did this baseline assessment, trying to understand what type of waste we generated, and the results was really interesting. So looking specifically at packaging waste, we found that 50% of the waste that humanitarian agencies generated was cardboard. 32% of that 32% was plastic, and of course plastic is a very heterogeneous category. And you see on the right what this 30% is consisted of. PP woven bags, which you see on the picture on the right, usually used to distribute rice, is the biggest category. Then you've got 16% PET bottles, which are the typical plastic bottles that we use for water, HDP container, and plastic bales. And then we've got 10% of the whole packaging, which is tin cans, which are used usually to distribute vegetable oil, as you see on the picture here, and 77%, which are sachets, and very often used, as you see also in the picture here, for therapeutic food distribution. And these sachets are very problematic because they're composed of various materials. They're 3-layered, and they're technically not recyclable. So even if there was the infrastructure in the country, it's not possible to recycle it technically, because we'll have to separate the material. Next slide, please. So with regards to recycling, considering that it's that there's a lot of waste that we cannot avoid, let's say, we've decided to do a mapping of recycling infrastructures in the countries where we operate. And if you click on the link here, you'll be able to access the different countries that we mapped. And some of the main finding that we found is that only a limited percentage of our recyclables are actually recycled. You shared that figure, Kermit, at the beginning, that only 9% of plastic worldwide are recycled. So it's really important to focus our efforts on reducing our waste. But when recycling companies exist, and there are quite a lot in the countries where we operate, it's very often for cardboard, paper, metal, and in some cases plastic, but it's often just PET, the plastic bottles, we've had quite a lot of difficulties finding recyclers for PP woven bags, for instance. In some countries like Kenya, they are, but in other more remote areas, it's more difficult. There are a wide range of different types of companies in the field, as you may know, ranging from the informal sector that is typically involved in the collection to resellers, which are either reselling in countries or exporting the recyclables, or in some cases, they're actually reprocessing the recyclable materials in the country itself into something else, like buckets or basins, etc. One thing that we found was interesting is that when companies exist in the field, it's often only in capital cities, which is problematic for us humanitarians because our operations are often in remote areas. So we need to think about transporting those recyclables from the project location to the capital cities, and that that has a cost. So that's an important challenge for us. Next slide, please. And also what we found is that even when there are recycling companies in the field, it's very difficult to ensure the quality of the recycling process, the level, for instance, of if the wastewater is properly managed, even the condition, the working conditions of the workers, etc. So, like saying that it's not because there's a recycling infrastructure that it's necessarily done in the most environmentally friendly way. So that, in a nutshell, is what we found from our research. Thanks.
No, thanks, Samantha. Yeah, no, it's interesting to see really kind of the different options available, I think. And yeah, I think sort of thinking back to that waste hierarchy, and really recycling is still kind of in the middle. It's not the most preferable. Marco, could you talk a bit about some good practices you've seen in the field to reducing waste, eliminating waste, etc.?
Sure. One good practice I would like to share refers to the use of heavy-duty plastic containers instead of plastic bags to distribute health commodities and pharmaceutical products to service delivery points, hospital departments, dispensaries, or satellite clinics. For sure, we need to make sure that these containers are clean at all times and that we check routinely for damages. Just to give you an example, in Sierra Leone, we have been using plastic totes to distribute supplies to hospital departments since 2013, saving over 10 million plastic bags in 10 years. Sometimes, of course, due to logistics constraints, it's not possible to use reusable containers, so the returning process of the plastic boxes maybe is not feasible. In that case, we have repurposed suppliers, cardboard boxes, and other shipping materials available on hand to reduce the amount of single-use plastics. Thanks.
Brilliant. Thanks, Marco. Yeah, and I think that goes back to that sort of reduce, reuse on the hierarchy, so above recycling. And then, Samantha, could you talk about, from that sort of global perspective, if you could give us an example of humanitarian organizations successfully reducing their environmental impact?
Yes, thank you. Yeah, I wanted to share here some examples focusing again on packaging. The first one is the ICRC, who's been very involved in sustainability since 2012 as an organization, and they they removed the single-use plastics from their kitchen sets. You see on the picture on the left is the kitchen set before, and after discussions with their suppliers after. So there were some packaging needed to protect the items, but in a much lesser quantity than previously. And this helped save 53 tons of plastic since 2012. So that's huge. Then another example, which is the World Food Program here, switched from bleached white cardboard for their distributions to brown cardboard, and that simply helped reduce the contamination of water sources during the recycling process. So these small changes can really go a long way. And then I wanted to share a third example. If you could go to the next slide, please, from the NGO Shelter Box, which is a British NGO. And what was very interesting in this case was that Shelter Box wanted to ship a container to Kenya. But given the legislation in country banning the use of single-use plastic, the container got refused. So they had to repackage all of their items. So this triggered a discussion within the organization, and the same, they eliminated single-use plastic from their kitchen and shelter kits. And they've managed to save 150 plastic bags since 2020. So yeah, I think just triggering that discussion with suppliers and just thinking outside the box, doing things differently can really go a long way.
Fantastic. No, that's great. And even though they're not medical examples, I think they're so applicable across the board, really. And Marco, I see we're getting a bit squeezed for time, Marco, but yeah, I just wanted to ask you, going back to that medical angle, really sort of the COVID pandemic, how did that change your waste management practices? And can you give us some examples from the field?
Sure. For sure, COVID pandemic had a huge impact on the volume of waste, especially considering the single-use disposable items that were in use. We started, after the acute phase of the pandemic, we started shifting towards reusable items, if available, like reusable face shields. We also noticed that it was very important to educate the staff, of course. We saw earlier that over 75% of the medical waste is made up by regular waste. And using waste bags of different colors was very helpful in educating the staff in separating medical and regular waste. It was also important to plan storage areas to protect the commodities and to avoid damages and increasing the amount of supplies that could be damaged and then become waste. We also learned a lot of lessons regarding donations, when to say no, especially when private companies or donors were donating items that were not useful for the project, or items that were no longer meeting quality criteria or technical requirements. So of course, it's very important to know what you need in the humanitarian project, the space that you have available, to be sure that you decrease the amount of possible waste that you have to handle in the end.
Fantastic, thank you. Great. And then Samantha, a sort of a wrap-up question really for you from that global perspective, whether JI has that vantage point. Can you give some key takeaways or suggestions for organizations looking to minimize their environmental impact?
Yes, thank you. Could you go to the next slide, please? No. Yes, thank you. So yes, that's I think I referenced that a few times in my presentation, but reducing at source is really key for us humanitarian organizations, and this requires a discussion really with our suppliers. And as we've seen from our experiences, that suppliers are really very keen on changing their specifications. Sometimes it generates savings. So this is just a matter of having that discussion with the supplier. But when it comes to recycling also, I think one of the key takeaways is that recyclers in the field are more likely to collect our recyclables if they are stored properly, sorted by different types of materials, but also available in large quantity, so that it's economically interesting for recyclables to come and pick up for recyclers to come and pick up the recyclables in the warehouses of a humanitarian agency or at the office. And also, I guess the last point I wanted to make is that we tend to think that being more green or doing efforts to reduce our environmental footprint costs money, but actually we realize that it's not always that. It can sometimes be even generate savings. I was talking to an NGO working in Liberia this morning, who's actually selling their recyclables. I mean, it's not a lot of money, but still it can generate savings. But I think we need to keep in mind that that extra effort that humanitarians have to do to reduce their footprint requires often time and human resources. And most importantly, I think to think outside the box and do things in a different way. Thanks.
Brilliant. Thank you, Samantha. And then, Marco, a similar question to you, but from that field perspective, if you have key takeaways for organizations.
Sure. I would like to share 3 considerations with 3 different perspectives. The first one is about the environmental impact of shipments. Emergency uses different methods of transportation to ship supplies to the humanitarian projects. So we go from air cargo, where you have a very high carbon footprint. They're very expensive and fast, but then you can use air cargo shipments to ship urgent items or for cold chain products. We also use trucks, which are more affordable. They're very fast and they still have a high carbon footprint, but they can be used to reach hard to reach places or for the last mile transportation of commodities. And in this case, you can always plan to reduce the number of trips, to consolidate the orders, to consolidate the shipments. Best case scenario, so the shipment type with the lowest carbon footprint, considering the distance covered, is of course container ships, where we can ship heavy, bulky items, non-urgent orders. It's cheaper than air cargo for sure, but it's also slower. So you have to consider the space that you have available, and in general, you have to keep in mind the level of inventory that you need to keep in the projects. And we talked about shipments, and of course, it relates directly to how we manage our stock in the humanitarian projects that are run. If the quantification of needs is accurate, then you can reduce the need for urgent orders. You can avoid overstock. If you apply FEFO and if you apply stock rotation, then you can maximize the shelf life of all commodities. You can create less waste. You are able to donate overstock if you realize that this item is no longer needed by your organization, so someone else can use it. And if you follow proper storage conditions and good storage practices, then you can reduce the amount of damaged items that you have to handle. You optimize the available resources, and also you optimize the environmental impact. The last consideration, next slide, please, is about the budget. So good waste management practices, they should receive adequate funding. We saw earlier that we need to pay third-party waste management companies that will handle the waste. We need to buy fuel for the high-temperature incinerators. We need to buy durable plastic containers that will replace plastic bags. And we need to buy paper and fabric bags to replace plastics. So these good waste management practices should provide accountability So we should have written standard operating procedures, written guidelines, and they should also provide transparency. So records of destruction for expired or damaged items, for example. Thank you.
Thank you, Marco, and thank you, Samantha, for the discussion. I'm going to hand over now to Nora, our open question and answers. And thank you all.
Yeah, thank you, Gurmeet. Thank you, Marco and Samantha, for such great takeaway messages. I think that the audience values them very much. But before we go into the Q&A, I would like to ask the audience if someone would like to share any challenges that you are facing in the field that were not mentioned during this presentation. If you would like to raise your hand and share that, or write it in the chat. We welcome any suggestions or good practices that you may have to overcome those challenges as well. So if you would like to write them in the chat, that would be very, very useful for the audience as well. We're looking for not only challenges, as you could see in this webinar, in this technical discussion, but also solutions that you can apply in the field. So feel free to write those in the chat, please. And we have several questions. I will start with Benita, who is asking, is there any kind of support that either joint initiative or emergency does through advocacy of policies for better waste management? And are there any steps that you take to collaborate with international development partners to control their waste due to primary and secondary packagings when they do the humanitarian supply chain support? So either Samantha or Marco can go first. If you do any kind of support to do advocacy for policies to better waste management in countries.
I mean, our main target is humanitarian organizations. Yeah, so yes, we do a lot of advocacy work for humanitarian organizations to reduce their waste, because the idea is that humanitarian organizations generate waste that is different, perhaps that is different from what is generated locally by the households. So we do a lot of advocacy, but just focusing on humanitarian organizations. And we are not necessarily working with development organization, if that is the sense of the question. Thanks.
Yeah. And what about emergency, Marco?
So we don't do advocacy directly for the management of waste. We do follow the guidelines in the countries where we are operating, and we try to set the bar for the management of the operations. Waste management is part of a more general logistics and pharmacy management inside the country, but the advocacy is more for the provision of free healthcare and free treatments to the population in need. The management of the waste or the management of the other logistics operations is more a byproduct of the advocacy for the free healthcare or the free treatments to be provided to the population.
Thank you so much for those answers. There's another question. Is there any process that shows the recycling of plastic in the areas of the targeted individuals after each distribution process to the beneficiaries?
So I guess it's examples of reuse or repurposing. I think That's the sense of the question. Yes, we do see that in some cases, but it's really depends on the material itself. Some materials like the tin cans, for instance, have an economic value that is more important, and that it can be repurposed into other items, and that we have seen that, for instance, in the Central African Republic. But other items like plastic films are very difficult to repurpose. Plastic bags, once they're torn, I mean, there's not much use we can make out of it. So it really depends on the type of item, and so we also encourage organizations to buy materials which are packaged in more solid packaging, so that it can be repurposed at the end.
Okay, so this is related to the next question, because someone is asking if the joint initiative or another group work on policy legislation with countries receiving any type of aid on the type of packaging and waste allowed to enter countries.
So we have done, I mean, we have not mapped all the legislation, but there are an increasing number of national legislation, and this database work is being done by the Plastic Pollution Coalition, and I can send you the link. They did a mapping of all the legislation in place in the different countries, whether it is on the use or the production or the distribution of plastics. The problem is often more a question of enforcement of the legislation. In a lot of countries, for instance, Haiti, there has been a ban on polyester plastic for a number of years, but it's not at all being enforced, and we continue, even us as humanitarian, to buy it. So it's important to have a legislation in place, but it's also important to respect it as part of the do no harm principle as humanitarians. I hope that answer your questions.
Yeah, and there's a okay, so there's a comment from Daniel Forrester. He's saying perhaps, let's see, perhaps you might have comments on any sustainability efforts your companies are making in reducing waste. Let me see if I captured that correctly. Some pharmaceutical suppliers, if they have any suggestions or comments about any sustainability efforts that those pharmaceutical companies are making in order to reduce waste. If someone would like to make a comment on that, someone from the audience who has joined us today. You can put the answer in the chat if you prefer, or if you can raise your hand and we will give you the floor to respond to that.
Nora, would it
Yes.
be okay to answer one question which I think is important that was highlighted in the chat as well, is the use of alternative materials to plastic packaging. So we often talk about compostable or biodegradable or oxo-degradable plastics or bio-based plastics. Okay. As a silver bullet solution. And I just wanted to highlight that these are very complex decisions to make, and they really shouldn't be considered as a easy, quick win, because they looking at, for instance, just biodegradable plastics, they're very difficult to biodegrade. They won't necessarily degrade like this in the environment, and it takes facilities which are not necessarily present in humanitarian contexts. And they have a lot of, they also, to produce them, the carbon footprint is huge. So yeah, just that they shouldn't be used as silver bullet. But we will, as the joint initiative, publish a note on that very soon. So I'll make sure I'll share the link to that.
Okay,
thank you. I've talked so much.
No, that's good. That's what we're looking for. You know, thank you so much for making that comment, Samantha. And Enki Henry, would you like to ask a question? If you would like to, we can open the mic and you can ask the question, please. Please go ahead. Daniel, can you open up his mic, please?
Yes, Nki should be able to unmute.
Yeah, I can. I see he's on mute. Yeah. Okay, in the meantime, we will move to the next questions. Okay, there's a question
Nora,
about.
We have one
Yeah.
other person with their hand raised. Kalechi?
Yeah, but I don't see him.
Well, I can allow Kalechi to ask their question. So, so a moment.
Hello, can you hear me?
Now we can hear you.
All right, great. Thank you very much for the presentations. Really beautiful, really exciting, and I see a lot of things that we are also doing. I work with the Economic Supply Chain Project in Nigeria, Global Health Supply Chain Project, and we do a lot of importation of pharmaceutical products, warehousing, and then distributing to all the facilities in Nigeria, supported by PEPFAR, PMI, and the Global Fund. And oftentimes we also encounter expired and unusable commodities, and we have to do reverse logistics to move them to a central location for waste treatment. What actually caught my interest here is the issue of plastics, which globally has become very prominent after the COVID-19 pandemic, with the increase in the single-use plastics. Here in Nigeria, there is an alliance called the Food and Beverage Recycling Alliance, FUBRA, that are pushing the extended producer responsibility policy to be implemented in the country. This way, they are looking at ensuring that it helps reduce the use of single-use plastics, and then where they are used, the manufacturers of those plastics are responsible to ensure that the end life of those plastics. And they're also working in line with aggregators and other recyclers in Lagos State, Nigeria, and they're doing a lot in trying to reduce plastics that are found in the marine waste and in the waste in the environment. So it's really interesting, and I think I can actually see a couple of things that I can also suggest. I can also take back to my organization from the waste management angle of the presentation. Thank you.
Thank you so much for your comments. Okay, so probably we'll have time to answer one more question, but remember that we will respond to those questions afterwards, and we will send you the answers with the help of our panelists today. Okay, so someone is saying, is there an initiative from the donor of medical humanitarian donation in this subject, how to include some policy regarding reduction of waste for medical shipments? Maybe that's a question for Marco.
Yes, I'm not aware of specific initiatives for the reduction of waste from shipments. Of course, from donor side, there is an awareness regarding the use of plastics and the use of packaging materials. In one of the slides that Samantha showed us today, there is a list of organizations that are supporting the initiative, and there are names also that we see as donors. So of course, and that's why I also stressed out the importance of funding, because the requirements then need to be made visible in budget lines, because then it becomes a way to show that there are some costs, but there are some benefits related to how the waste is managed and how the effort is made to reduce the consumption of plastics or the production of waste. I hope I answered your question.
Thank you, Marco. And there are very good resources that people are sharing in the chat. We will share them with all of you afterwards. So we really appreciate your support in sharing those resources as well. And also, please feel free, as I said before, to share any challenges that were not mentioned here and any good practices. You can do that afterwards through the Humanitarian and Commodity Logistics community of practice. So we welcome all your comments, challenges, good practices, and ideas for technical topics in the future. So thank you so much. So moving on to the wrap-up sessions, we have some ideas for action as we usually do with this type of technical discussions. So it's very important to integrate sustainability into procurement processes and decisions. As we saw before, it's very important to think about how to protect the environment, how to minimize the impact of the humanitarian work in the environment. Also include environmental considerations when you are designing the project. And very, very important that was something that Gurmeet, Samantha, and Marco mentioned throughout this technical discussion is the importance of strengthening supply chain management sustainability culture, to incorporate that into the culture of the humanitarian assistance, from quantification to delivery to the last mile. And not even from quantification, from selection. As Samantha mentioned before, that there, for example, I think it was WFP moved from the white cardboard to the brown cardboard to minimize the impact of contamination. How important it is to begin negotiating with suppliers so that they start using a more friendly materials for the environment. How important it is to quantify the right quantities in order not to create an overstock of your needs. How important it is to quantify better in order to avoid emergency shipments, so that you can select that mode of shipment that will reduce the impact on the environment. How important it is to have good storage practices so that the products, once they arrive in the warehouse, are not damaged and therefore end up being wasted. And the same thing when you transport and distribute the products, how important it is to use the appropriate means of distribution to avoid damage and therefore waste at the field level, and especially in the last mile. So all of these important takeaway messages that Marco and Samantha and Gurmeet share with us are very important to take into account. Next slide, please. And here we have some resources that we want to share with you, as well as the resources that were part of the presentation that Samantha and Marco shared with us, and the resources that the participants have been sharing in the chat. We will add those to this slide, and when we share the presentation and the recording, you will have all of those. But keep sending us any resources that you know of that are related to this topic, and we will share it with the rest of the community who have joined us not only today, but who are part of the HCL community of practice. Next slide, please. So just remember that this type of technical discussions are part of the Building Capacity to Improvement Health Commodity Management program funded by USAID BHA. And we are very happy again to have had Samantha and Marco in these technical discussions. We thank you so much for your participation, and we will see you next time. Thank you, Gurmeet, for your great facilitation as well, and see you next time. Take care.